name is Dr. Adithya. I am a consultant GI hepatobiliary and liver transplant surgeon currently practicing in Bangalore. Today I would like to discuss a few things regarding hepatitis. Before going into hepatitis, I would like to emphasize on the importance of the liver. So how I normally compare the liver is, if we think of the brain and the heart as the president and the prime minister of a country, then I would equate the liver to the common man, that is the workhorse of the body. The liver plays a very vital role in all the activities and in maintaining a normal homeostasis in the body. Hepatitis is a very common disease which we come across regularly. There are different types of hepatitis. What exactly hepatitis means is it is the inflammation of the liver which results in damage to the liver. We can classify hepatitis based on the duration of onset into acute and chronic hepatitis, or based on the cause of hepatitis, where we can say whether it is viral hepatitis, alcoholic hepatitis, non-alcoholic steatohepatitis, autoimmune hepatitis, and hepatitis due to toxins, so on and so forth. How do we diagnose hepatitis? How does a patient present with hepatitis? The common symptoms we generally notice in the OPD are the patients present with flu-like symptoms, with fever, jaundice, loss of appetite, pain abdomen, generalized bloating sensation in the body. And when we see such patients, we generally advise a few lab tests and some investigations. Coming to the lab tests, a common liver function test and a workup based on the findings we see in the liver function test will help us in determining the type of hepatitis we are dealing with. Most commonly, we see a raise in AST and ALT, which are the enzymes produced in the liver, and this indicates that a patient may be suffering from hepatitis. Apart from this, we also look at the viral profile depending on the history. If the patient has diarrhea, then we think about viral hepatitis. If the patient is consuming alcohol or is on other medicines, then accordingly we think about drug-induced or alcoholic hepatitis, as the case may be. Once a clinical suspicion is raised, we do further workup in the form of imaging, which may be an ultrasound or a CT or MRI to look at the liver condition. Along with this, sometimes we also suggest a biopsy of the liver to look at what is exactly going on in the liver. Once a diagnosis of hepatitis is made and we know the cause of hepatitis, if it is viral hepatitis, we generally try to work out what type of virus is affecting the liver. The common hepatitis viruses are hepatitis A, B, C, E, and sometimes D along with hepatitis B. So depending on the etiology of the hepatitis, there are different modes of treatment. Hepatitis A and E are generally self-limited, and they don't particularly need any treatment other than supportive treatment. Hepatitis B in an acute phase is generally treated conservatively, but if they go into chronicity, then there are specific medicines which can help in reducing the disease burden. Hepatitis C, once diagnosed, is potentially curative with very good drugs these days. Once the diagnosis is confirmed, we can initiate appropriate treatment. Alcoholic hepatitis is generally seen following heavy doses of alcohol or binge drinking in the acute setting. Sometimes, or most of the times, we see that alcoholic hepatitis leads to chronic illness of the liver. The treatment of alcoholic hepatitis also is conservative. We treat with IV fluids and other supportive medicines till the patient recovers. Coming to other causes of hepatitis, the most common cause we see in India these days is called non-alcoholic steatohepatitis, which is commonly due to diabetes. Diabetes leads to excessive fat in the liver, leading to damage, and this can result in chronic as well as acute illness. The most common again is chronic form of liver disease, leading to cirrhosis even. The best treatment for a liver disease is to prevent it. So how can we prevent liver diseases or hepatitis? For viral hepatitis, hepatitis A and B have very good vaccinations. If we vaccinate kids or even adults or high risk population against hepatitis A or hepatitis B, this can be prevented. Unfortunately, hepatitis C does not have any vaccine as of now, but it is curative with medicines. Apart from this, for alcohol, the limitation, for alcoholic hepatitis, the only effective treatment is to stop consumption or to reduce it to a minimum so that the damage is minimized. Once a patient has developed alcoholic hepatitis, we definitely advise absolute abstinence from hepatitis. For drug-induced hepatitis or diabetes-induced hepatitis, the causative factor or the drug has to be stopped or modified. And in diabetes, good control of diabetes along with exercise is the only way to effectively prevent non-alcoholic steatohepatitis. Apart from this, if any of the patients have symptoms due to hepatitis or if they feel they suffer from hepatitis, they should not hesitate to contact the nearest liver specialist or a hepatologist, and they should actually be forthright in coming forward with their symptoms and getting treated at the earliest. Can hepatitis spread from one person to another is a commonly asked question. Viral hepatitis can spread from one person to another, and hence we advise due care during this period. Your physician will be able to tell you what is the appropriate action to be taken and what are the modes of spread and how to prevent hepatitis from spreading from one person to another. The other hepatitis, alcoholic or drug-induced or any other cause, does not spread from one person to the other, and usually it can be treated and appropriate control can be exercised. Thank you.